This is Dr. Chris from Human 2.0. As you may know, I'm an orthopedic surgeon, a sports medicine physician, and I operate primarily on knees and shoulders. Quite often my patients are asking me about things that they can do to optimize their rehab after knee surgery. I myself had knee surgery yesterday, and so I thought I'd share with you some of the things that I think will help patients to optimize themselves following their own surgeries. First of all, on the day of surgery, following surgery, you're going to want to make sure that you rest, okay? And by that I mean you want to keep your day relatively light. So, you're not going to plan going back to work, you're not going to be planning any big shopping trips or anything like that. You want to keep the day relatively light to give your operated joint and your body a chance to recover from the surgery itself and from the anesthetics that have been administered, whether it's a general anesthetic or whether it's been a spinal anesthetic. The second thing that is important is that we want to use ice. We want to use this in a relatively sparing fashion because we don't want to cause any damage to the cells, and current literature is showing now that with too much icing you can actually cause necrosis or cell death. So we want to use the ice very sparingly, and generally what I tell patients is that we should use ice for approximately 20 minutes every 2 hours on the day of surgery. And they use that in combination with elevation to help minimize the swelling that's in the operated joint. Next, we want to consider analgesia or pain medication. And so this is generally of two types. So usually I tell people to piggyback two medications. One, the medication that I prescribe, which is typically a narcotic. On top of that, they want to take something that they can get over the counter, whether that be Tylenol or Advil. The way that I tell my patients to use those medications is thus. I usually advise them to take the Tylenol or Advil every 4 hours and to take that regularly. In this way, we build up a baseline of pain medication in their bloodstreams so that they don't tend to have spikes of pain every couple of hours. Then they can use the medication that I've prescribed, which is typically a narcotic analgesic, and they can use that to smooth out any peaks that they may get with activity or at any time. By using the pain medication this way, you use a smaller amount of the narcotic, and you find that most people find that they have a better control of their pain symptoms overall without having as many of the side effects that occur with narcotic analgesics, such as lightheadedness or feeling groggy and gastrointestinal complaints such as constipation or nausea. The next thing that I talk to my patients about is gentle range of motion. So on the day of surgery, for myself, unless otherwise indicated by what I've done in the surgery, I'd like my patients to start moving their joint right away. One of the biggest things that is going to influence their range of motion after surgery is the time at which they first start to engage in range of motion. And if they do so before their knee has a chance to get stiff, the likelihood of them having good range of motion in a shorter time period following surgery are going to be better. So we want people to start, or at least I would like people to start with range of motion following the surgery, unless I have otherwise indicated. The next thing I talk to people about is the dressing. And quite often there are lots of issues that arise with this, but the general rule of thumb is don't look at the wound. We want you to keep the dressing covered, keep the wounds covered with the dressing. And the reason is this. When we perform the surgery, we're going to put on an antimicrobial agent beforehand, and we leave that on after surgery. And we put a sterile dressing over top of that. So anything that's underneath the dressing is essentially sterile. Anytime you take the dressing off, you increase the likelihood that you could introduce bacteria into or around the wound. Generally, we like to leave the dressing on. We don't wash off the antimicrobial agent. You may notice it on your skin afterwards. Your skin may be tinted blue or purple or orange or brown, but that's okay. We leave that on there, and we leave it on intentionally to make sure that we maximize the antimicrobial effect of the agent that we've applied. If there is any bleeding on the dressing, okay, any slight shadowing, again, don't worry about that. These things are oftentimes expected. We try to close the wounds in a watertight fashion, but sometimes there is some ongoing drainage from the wounds, and this may show up as some shadowing on the bandage itself. So don't be too concerned with that. As long as the bandage is not completely soaked through with blood, bright red blood, or continuing to drain for many, many hours or overnight, then don't worry about that. Generally, what I would tell patients to do is to apply some pressure directly over the bandage, and this will usually help to stop any bleeding that has occurred. But other than that, just leave the dressing intact and don't worry about it. The last thing that I talk to people about on the day of surgery is compression. And so there are a number of ways that you can do that. One of the ways that I've started to use more frequently is compression stockings. Now, certainly I don't use that on all of my patients, particularly if I think that the patients are going to be active after surgery, but I think compression is something that will help with post-operative hemostasis or bleeding control. And I've now started with some of my patients to have them fitted preoperatively with compression stockings, which they can wear post-operatively, which serve a number of purposes. Number one, they apply pressure to help bleeding control. Number two, they also help to prevent against deep vein thrombosis or blood clots in the legs. And number three, they also serve to help keep the dressing applied snugly to the surgical wounds. So these are some of the things that I think are important for people to think about on the day of surgery. And as I said, each surgeon may have their own preference, but these are the things that I ask my patients to do that I think will help to have their recovery proceed in a smooth fashion.